On top, say, half the people where they Nigerian are women. Now, different suffer and yama their IDC. People where they live with disability income, nobody send them, nobody look their side. The 2021 revised national gender policy, no leave anybody for back, Ide hala, no come out anybody, no wounded person, and no chook anybody head come out. On top, say, you think, say, you no follow. Omo, now equal level for everybody. You don't see now, say, now all of us get work to make sure, say, we include women for everything where we they do, make our country for better. Go www.rappanigeria.org. Make you see everything where they the policy. Now, Women Rights Advancement and Protection Alternative Rapper. Join body with Federal Ministry of Women Affairs with support of Macarthur Foundation. Now, them carry this message come.
Several reports have shown that only about 1/3 of the 30,000 primary healthcare centers across Nigeria are functional, despite huge investments made over the years by the federal and state government. The National Primary Healthcare Development Agency, NPHCDC, has also said that only about 463 of Nigeria's 25,843 primary healthcare facilities have the required skilled birth attendants. No Nigerian leader spent more time in hospital abroad than President Muhammadu Buhari's approximately 232 days. It took him only 2 years in office to beat the record set by one of his predecessors and Katsina Kingsman, the late Umar Yar'Adua, who spent 109 days on medical trips abroad in his 32-month stay in office. An analysis of the budget shows that 1.17 trillion, that is about 5.75%, was allocated to the health sector out of the total 20.5 trillion budget for the 2023 fiscal year. Every day, we hear stories of women suffering from maternal health issues, soliciting for funds from the public because they cannot afford good healthcare services in their communities due to poverty, lack of quality equipment, and health attendants in primary healthcare centers in Nigeria. Many pregnant women still seek the services of traditional birth attendants for delivery. Many children in the rural areas also miss out on routine immunization, which is meant to be one of the responsibilities of a functional primary healthcare center. Unmasking the Truth today on your radio station will address issues of primary healthcare delivery system in Nigeria. My name is Esther Olaribe. Unmasking the Truth is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the Macarthur Foundation. We spoke to women across the country to share their story on the issues of healthcare delivery system in their communities, how it has affected them, and what is the state of the primary healthcare center in their communities. This is what they have to say.
This thing where you ask, it fire me for this our community. The healthcare center in my community no good at all. They don't even get good doctor. You know, we imagine this kind of thing. Make only one doctor get duty for afternoon. The last time where I go there, I come sit down. I sit down from 11 a.m. till around 5 p.m. before they answer me. Someone I fire. Not be only me come sit down with plenty. Even women wey get belle for inside, they sit down. They no quick answer these people. Please, so make government help us look wetin dey happen for this our community and help us. Na the community health center we the less village dey go. Make dey help us as we no get money go private. The health center wey we get for community, they no dey quick answer. Sometimes doctor go just leave the duty and go somewhere, go chop, go flex, then come back again. All this kind thing, e no good oo. E no good. Even if person wan born pikin, the money wey dem dey collect the money is too much. Make government help us look this thing and please make dey help us, make improvement dey oo. Nigeria go better oo.
I wan talk about the health center for the place is good. The health center is nice. There's equipment, but where the problem dey na the people to work. Sometimes they do come late to work. You understand me? So everything dey okay. And concerning the delivering of pregnant women, yes, when pregnant women come like this, like you get one scene where I seen, we were looking for nurses. We just dey look for nurses to do this thing. Nurse, you go see nurse with their nonchalant attitude, they go dey come late. So, but the equipment, everything, our governor, that's our past governor, before this one come now, he try for us. He build the health center there. There's equipment, there's lights, water. So he try for us for the pregnant women to come and deliver their babies and the rest of them. But now we dey talk about make government employ people. Make government employ people because e get wetin dey happen for the states. They go dey employ themselves. They should employ people, better medical personnel. They should bring better medical personnel for the state. Now we dey please. So more ask for the governor, the president, those in power. They should they should create employment so that people will not be dying. There is health center, yes. The equipment are there, very useful, but people are not there to handle the job. So now, so I want to talk on. I thank you. On good morning. And some of the equipment there, they are old equipment. It don't old. Some of the equipment where they use, it don't old. They don't old. Some of them, if you just come, you will see grasses for the health center building. So we are all doing that. They should employ more hands into this for the health center. How can hospital look as if there is prison yard? So please, we are begging. We have equipment. You go see equipment go there, but no human being to use them. The place go there, grasses go full everywhere. So what do they talk now? Say make they employ people so that it go help, so that the reduce of death rate among pregnant women from my state. Thank you very much.
As you have heard, women in this rural area are suffering as a result of the poor state of primary health care centers in their communities. Recently, the International Maternal Newborn Health Conference raised the alarm over stagnation in the reduction of maternal health worldwide in over 60 countries in Asia and Africa, and also advocated for a strong health system with improved data. Worried that the affected countries would not meet the Sustainable Development Goals SDGs by 2030, it stressed the need for them to invest in building a strong health system with improved data for planning to lessen newborn deaths. During the 2015 general election, ex-President Muhammadu Buhari presented his party's manifesto themed Building a New Nigeria. A major promise in the manifesto described at the time as one of the most ambitious and elaborate in the nation's political history was the provision of robust healthcare services by the administration. The specifics of the promise for the health sector include nationwide domestication of the Child Rights Act, free antenatal and maternal care for pregnant women, free healthcare for babies and children up to the age of 12 and the aged, and free treatment of persons with infectious diseases, raising the gross national health expenditure per person per annum from less than 10,000 naira to about 50,000 naira, and raising federal government-owned hospitals to world-class standard within 5 years through investment in infrastructure, diagnostic equipment, and continuous professional development. A lot of plans, but little was achieved during the 8 years of the President Muhammadu Buhari-led administration. Unmasking the Truth looks at the issues of healthcare delivery system. Let's go back to the streets and get more comments from women on this issue.
Ibi ká ṣe ìtọ́jú fún àwọn ará ìlú, wọ́n gbìyànjú dáadáa. Ọjọ́ tí mo kọ́kọ́ mú ọmọ mi lọ síbẹ̀, bàtà débẹ̀, wọ́n kọ́ ní pé ká kọ́kọ́ lọ ṣe àyẹ̀wò ẹ̀jẹ̀ lóríṣiríṣi àyẹ̀wò tá a ṣe. Àyẹ̀wò yẹn tá a wá ṣe bàtà dé mo lọ sọ́dọ̀ wọn tí wọ́n wò. Pẹ̀lú àyẹ̀wò yẹn ni wọ́n ṣe ìtọ́jú ọmọ mi níjọ́ náà. Ìjọ́ yẹn náà kẹ̀rẹ̀ mo bá àwọn olóyún náà ńbẹ̀. Ìdẹ̀rí bí wọ́n ṣe tọ́jú wọn dáadáa, wọ́n tọ́jú àwọn olóyún dáadáa. Lẹ́yìn ìjọ́ tí mo tún wá padà lọ ká tún lọ padà lọ gba àwọn ìtọ́jú tó kù. Mo bá àwọn ọlọ́mọ náà, bí wọ́n ṣe tọ́jú àwọn ọlọ́mọ náà, wọ́n ṣe dáadáa. Wọ́n gbìyànjú ní nǹkan tágbára wọn ká. Bó tiẹ̀ já sí wípé kò sí ibi tí wọ́n ti ń ṣe àyẹ̀wò ẹ̀jẹ̀ ń bẹ̀. Wọ́n máa tọ́ba ti bẹ̀rẹ̀ dé wọ́n máa sọ pé ká lọ ṣe àyẹ̀wò ẹ̀jẹ̀ yẹn. Èsì àyẹ̀wò ẹ̀jẹ̀ yẹn la máa mú lọ bá wọn, wọ́n máa fi wá treat wa. Káwọn ìjọba wa kí wọ́n gbé ọjọ́ kó gbìyànjú tó bá wa gbé láàbù wá síbẹ̀ tí wọ́n á sì pé kí wọ́n wá sí máa ṣe àyẹ̀wò ẹ̀jẹ̀ fún àwa.
Ẹ ní hospital ilé wa ní ìbí yìí, ní èyí tí ṣe primary health care, wọ́n gbìyànjú púpọ̀, wọ́n sì máa ń sa agbára wọn láti rí i pé àwọn tó bá wá wọ́n ní ìtọ́jú tó péye. Wọ́n sì máa ń ṣe ìtọ́jú náà bó ti yẹ. Ṣùgbọ́n mi ì lérò pé gbogbo ohun tó yẹ kán ní ni wọ́n ní, torí kò fi gbogbo ara sí káràmásìkí sí ilé ìwòsàn náà. Torí ní ilé ìwòsàn náà táwọn èrò pọ̀ ju òṣìṣẹ́ lọ. Àwọn aláìsàn bẹ́ẹ̀ ni wọ́n pọ̀ ju àwọn dókítà àbí àwọn nọ́ọ̀sì tí ń bẹ́ẹ̀ lọ. Torí ìgbà míì tá bá la dé bẹ́ẹ̀, èrò máa ń pọ̀. Ọ̀pọ̀lọpọ̀ èèyàn ni yóò jókòó tí ó sì ní sẹ́ni tí ó dá wa lóhùn. Àwọn tí ń bẹ́ẹ̀lẹ̀ wọ́n ń dáhùn èèyàn lóhùn. Ọ̀pọ̀lọpọ̀ ìgbà ni èrò máa ń pọ̀ ju àwọn òṣìṣẹ́ tí ń bẹ́ẹ̀lẹ̀ lọ. Kò sì kí ń ṣẹjọ́ àwọn náà torí pé wọn ò gba òṣìṣẹ́ tó pọ̀ síbẹ̀ náà ni. Kódà ọ̀pọ̀lọpọ̀ ohun tó sì táwọn èèyàn máa ń rò láti lọ sí primary health care ni pé òun tún jẹ́ tìjọba. Owó tí wọ́n sì tún máa ń rọjú díẹ̀ ju kí èèyàn lọ sílé ìwòsàn aládàáni lọ. Wọ́n gbìyànjú àmọ́ Ọlọ́run ó máa ràn wọ́n lọ́wọ́. Ìyànjú wọn ò kàn tó lọ́nà pé wọn ò ní òṣìṣẹ́ tó pọ̀. Ó sì máa ń dẹ́mi ọ̀pọ̀lọpọ̀ légbodò torí ọmọ mi tára rẹ̀ ti ń gbóná. Àbẹ́lòmíì tí kò mọ bí yóò ṣe ṣe ara rẹ̀. Pé tó bá wá ní pé àwọn ń lọ primary health care o, wọ́n fi gbéra wọn dùgbàdùgbà. Ìgbà tí wọ́n bá fi débẹ̀ pé wọ́n ó lò bí wákàtí kan sí méjì, wọn ò rí èèyàn dá wọn lóhùn. Àwọn kékeré tí ń bẹ wọ́n dá wọn lóhùn lọ́wọ́ nínú ilé. Tí wọ́n bá tètè rí èèyàn, ọ̀pọ̀lọpọ̀ ẹni a sì gbẹ́mìí mì níbẹ̀. Kò sì wú ni púpọ̀. Orí kìí ṣe ohun tí ń múnú èèyàn dùn. Nípa irinṣẹ́ náà, a lè sọ pé wọ́n ní irinṣẹ́ tó péye. Ṣùgbọ́n kíjọba náà á rọ̀ wọ́n kán dákun, kán bá wa dá sí i. Ilé àtọ̀nà tiwọn náà ò ní bàjẹ́ o. Àmín o. Rukaya Mohammed lórúkọ tèmi.
Magboro Health Center ò wá òkè o. Kò wá òkè rárá. Kò wá òkè. Tẹ́ bá gbé ọmọ lọ síbẹ̀, oògùn oríṣi kan náà máa kó fún yín. Wọ́n lè gbé pé èèyàn lásìẹ̀ǹtì àbí èèyàn ṣe pé kíní tó sìkì tó pọ̀ kán gbé lọ síbẹ̀. Ikú lèrè ẹ̀ṣẹ̀. Mi ò bímọ síbẹ̀ o. Mo ti kọjá ẹni tó ń bímọ, mi bímọ síbẹ̀, ṣùgbọ́n àwọn lọ ń bímọ síbẹ̀ ṣá. Unmasking the Truth on your radio station is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the Macarthur Foundation. The National Primary Healthcare Development Agency has said that only 463 of Nigeria's 25,843 primary healthcare facilities have the required skilled birth attendants. This means that 25,380 primary healthcare centers across the country have no skilled birth attendants, leaving residents of communities where they are located, especially women, to their fate. There is also the issue of unequal distribution of available skilled birth attendants in primary healthcare facilities. There is no doubt that the past administration is leaving a legacy contrary to their promises. Beyond medical tourism, they will be remembered for poor performance in industrial relations in this sector and primary healthcare development, and scary maternal and infant mortality statistics. We find it extremely important that we address the human resource for health gaps in our primary healthcare centers, because 80% of the incidents of maternal and child death in Nigeria occur at the community level, largely due to lack of services of skilled health workers in the primary healthcare facilities. Unfortunately, the primary healthcare centers are the most unattractive to our skilled health workers who prefer to be stationed at urban, secondary and tertiary health facilities. Let's hear from more women.
So, say whether they get all the equipment, and that one I don't go guarantee you say they get all. Because sometimes you go there, you go even they complain. They don't go tell you, say, see what they do you. Next thing that you say, I will give you injection. Okay, injection for waiting now. For what actually?
No test, nothing.
Injection for waiting. I will tell you, say, go take 3 days injection or 5 days injection. For what? Some of them, they will just carry injection, give you. Maybe 2 or 3 days or so. Thing will come back, or maybe the thing no go even go. So now be the issues there. Exactly. To know wetin be the problem first before then go attend to you, give you medication. This one is say then go just maybe you complain, see how are they feel. The next day, as you don't explain now, they will just write. Then you say then you go take injection for 3 days.
Okay.
You know, see, which is not proper. Yes, now experience where I don't get, and I make me there. So nobody say I hear from people. Well then, I just immunization day we go there. Like today now, I go there for immunization. Like my baby is now 1 year, and now there I deliver my baby. So as I go now, I tell me say, well, when it reach 1 year and 3 months, I should come back. They only gave me vitamin A. That's all. And I came back. That is all.
Okay, so
and the other time before now, I think that should be about 9 months. When she was 9 months or so. When we go there now, they give them only 2 injections, which is not complete. You understand? You get the one where they're supposed to give us, and they don't tell us say that one don't finish, or you know they're available, or come so time. Make una take her. You don't understand? And when me and my friend they go, as we reach there, we can't jam another person. He can't tell us say she been 3 injection. Now we say no, 2. He said no, 3. You say she don't face go. Now he can't say maybe we know follow and for back because she still they enter there. He said maybe we no follow and for back. Maybe don't be like saying that she tell us so. Maybe we allow her enter first. We can't say okay. She can't enter, then we can't follow. As we go they can't say true say but the thing no dey available. Say okay when we go come now. They can't say then we come end of the month. Till date, you know they don't give. So maybe I try look into the matter because they don't get equipment. I made a try, they check, they talk to them before they go take any step to give any injection or medication at all. May they make sure say they do tests, or even if they no fit do the test, may they refer the person to the place where you go do test. So may they bring results come, may they know the kind of medicine where they go give the person, not be to just carry injection give anyhow.
Ẹ jọ̀ọ́ fún ètò aláboyún abẹ́ ìjọba kán bá wa ṣe àmójútó sí i, kán bá wa ṣe àmójútó fún aláboyún àti àwọn ọmọ wa. Abẹ́ ìjọba kán bá wa ṣàmú ẹ jọ̀ọ́. Ọlọ́run á ràn ìjọba lọ́wọ́. Nàìjíríà dáa, kò ní bàjẹ́.
Ọ̀pọ̀lọpọ̀ bí ló wà tó jẹ́ pé
health care center wọn ó wà òkè gan, ó wà bẹ́ẹ̀ oríṣiríṣi ìlú pẹ̀lú oríṣiríṣi ìjọba àti bí wọ́n ṣe ń ṣe health care center wọn. So ọ̀pọ̀lọpọ̀ ibi wà sọ pé health care center wọn ó wà òkè gan, ṣùgbọ́n ní ọ̀dọ̀ títí wá ń bí báyìí mi rò pé health care center wa ó wà òkè, but they to some extent bí àwọn olóyìnbó ṣe máa ń sọ, mo fẹ́ nígbàgbọ́ pé health care center wa ó ṣe fún àwọn olóyún, torí tí wọ́n bá lọ fún antenatal yìí tí àwọn olóyún máa ń lọ fún, ó náà pé wọ́n máa ń ṣe ètò tó péye fún wọn, ó náà pé wọ́n kọbi ara sí àwọn olóyún yẹn púpọ̀. Wọ́n bá sì fẹ́ bímọ náà, wọ́n ní irinṣẹ́ tí wọ́n fi ń bímọ. So ní àárín bẹ́ẹ̀ yẹn mo fẹ́ sọ pé ètò tó péye wà fún àwọn tí ó lóyún, wọ́n ń ṣètọ́jú wọn bó ti yẹ dáradára, wọ́n ṣe ìtọ́jú wọn dáradára ní débi pé àwọn olóyún wọn kì í mọ ìnira kankan bó ti wù kó kéré mọ́, torí wọ́n mọ̀ pé ẹrù tí wọ́n gbé lásán, èyí tí ṣe ọmọ tó wà nínú wọn, wọ́n mọ̀ pé iṣẹ́ ńlá ni lọ́tọ̀ fúnra ẹ̀. Wọn ò kí ń fẹ́ kí nǹkan kan ó tún ní wọ́n lára pẹ̀lú. So wọ́n gbìyànjú, wọ́n ṣe ìtọ́jú ìyá, wọ́n ṣe ìtọ́jú ọmọ. Kódà kó tó di pé ọmọ jẹ́ bíbí gan, wọ́n ṣe ìtọ́jú wọn papọ̀ nínú oyún. Wọ́n ṣe àmójútó wọn bó ti yẹ àti bó ti tọ́. Wọ́n tọ́jú àwọn olóyún, wọ́n sì ń tọ́jú ìyá àti ọmọ tí wọ́n bá bímọ tán dáradára. Ọ̀pọ̀lọpọ̀ ìgbà gan wà tó jẹ́ pé wọ́n tún máa ń fún wọn lẹ́bùn. Ó ní mo fi sọ pé oríṣiríṣi ìlú àti bí àwọn ìjọba wọn bá ṣe ń ṣe òun ni. Ó nígbà kan tó jẹ́ pé àbúrò mi kan bímọ sí primary health care ní ìlú kan. Ẹ má jẹ́ dárúkọ ìlú náà. Ní ọdún tó bímọ yẹn, gbogbo pọ̀ lọ́wọ́ wọn. Ṣùgbọ́n ó dà pé ó tètè fi ẹ̀dùn ọkàn rẹ̀ hàn àwọn nọ́ọ̀sì yẹn nígbà tí ó máa ń lọ fún antenatal yìí táwọn olóyún máa ń lọ fún. Ó fi ẹ̀dùn ọkàn rẹ̀ tètè hàn wọ́n. Wọ́n sì sọ fún wọn pé kán gẹ́ẹ̀tì àwọn nǹkan tí wọ́n bá lè gẹ́ẹ̀tì ní tapára wọn, kán sa gbogbo agbára wọn láti ní gbogbo èyí tó wọ́n rò pé ó yẹ káwọn ní látọ̀dọ̀ títí wọn. Wọ́n sì gbìyànjú lóòtítọ́, wọ́n sa agbára, òun àtọkọ rẹ̀ wọ́n sa agbára púpọ̀. Wọ́n sì gbìyànjú láti ra àwọn nǹkan kéékèèké tí agbára wọn ká. Sí ìyàlẹ́nu gbogbo wa ìgbà tí yóò bímọ, àwọn primary health care yẹn náà, àwọn náà wọ́n dá sí. Wọ́n tún fún wọn láwọn ẹ̀bùn ráńpẹ́ kan kó tó di pé wọ́n kúrò níbẹ̀. Òun ló jẹ́ kí n máa sọ pé ó pé oríṣiríṣi bí kálukú ṣe ń ṣe nílùú tiwọn ó yàtọ̀. Báyìí là ń ṣe nílùú wa sì ní èèwọ̀ bòmíì ni. Òun ló jẹ́ kí n máa sọ pé ó pé oríṣiríṣi, àmọ́ kò sí bó ṣe lè lóhun burú tó. Kò sí primary health care tí wọ́n kì í bu iyì fún olóyún àti fún ọmọ inú wọn. Gàgà kó tẹ̀ ṣe pé wọ́n ṣẹ̀ṣẹ̀ bímọ tán, wọ́n máa ń bu iyì fún gbogbo wọn ni. Torí wọn kì í fẹ́ kí nǹkan kan kó ṣe wọ́n, kí èèrà kankan kó rìn wọ́n. Wọ́n máa ń fún wọn ní ìtọ́jú tó péye. Lórí ìtọ́jú aláboyún àtàbíamọ, wọ́n ń gbìyànjú púpọ̀.
Ụlọọgwụ gọọmenti dị na kọmuniti m n'ekwu eziokwu gọọmenti ya bụ ụlọọgwụ awụkwa ebe mmadụ ga-aga, maka na ihe a na-eme ebe ahụ, ị ga-asị ha na ị na-arịa ọrịa dị otu a, enye gị agba gị ọgwụ ha ma nnenekwe gị isi ha n'isi na-akụ gị akụ maọbụ n'afọ na-asa gị,
onweghị ekwu akara ngwa eji enene mmadụ ka mara ma onye ahụ onye na-ahịa na-ahịa ama nnenekwe gị ihe a ga-eme bụ achịrị ọgwụ chinye gị maọbụ agbawa gị ọgwụ ihe na-eme gị aka na-emekwe gị maka na ọ bụrụ ọgwụ ekwesịrị inye gị ka a ga-enye gị. Echetara m mgbe otu nwanne m nwoke gara ime appendix operation ama m otu m ga-eshikwa ya n'olu bekee ka eruru ebe ahụ enwere ihe eji eme ya. Ọ bụ na ọ bụrụ amara site na amara Chineke ọ kara ịbụ onye nwụrụ anwụ. Ọtụtụ ụmụ nwaanyị dị ime ifu ha ebe ahụ ọgwụ ekwesịrị ịgba ha ama ndị ikwu asị gọọmenti onwe nke ha wetara ha ga-ejichi ha ego ya. Oge ụfọdụ ịga ebe ahụ ndị nọọsụ ma ndị dọkịta na ebe ahụ ịma nke kacha njọ bụ na a ga-abịa na kọmuniti one ọ bụrụ ofu dọkịta ga na-eme ọga ụlọọgwụ nka ofu dọkịta abụ onye nọchitere anya na-ahụ maka kọmuniti hospital 5 dị n'okpuru lokal gọọmenti ofu. Ụrụ ihe ziri ezi na oshi ebe ata enwere nke bụ oge ụfọdụ ọwụ sọnsọ abịa n'ụlọọgwụ nka sị gị na ọkwa sọnsọ ụbọchị Wednesday ka dọkịta ga-anya abịa ụlọọgwụ nka sị gị ụbọchị Tuesday ka dọkịta ga-anya. Ya bụ na onye ihe na-eme ọ bụrụ na orughị Wednesday onye ahụ nwụzie ha. Gọọmenti biko gbatara anyị ọsọ enyemaka na ọ dịla nnukwu.
Dear people, this is the experience of women on the issue of primary healthcare centers in their communities. The demand for primary healthcare services in Nigeria remains below the desired level, largely due to social, cultural, and geographical barriers. A primary healthcare center should have one or more doctors, a pharmacist, a staff nurse, and other paramedical support staff to provide outreach services. It should also have a well-equipped open ward, labor room, children and female wards, doctor's office, staff quarters, an ambulance for referrals, drugs and equipment for immunization, preventive and basic curative care. The center is also to provide monitoring and evaluation, as well as maternal and child health services. Meanwhile, this is not the situation in primary healthcare centers across the country. The majorities of these primary healthcare centers are short-staffed, poorly equipped, lack electricity and water, and they cannot effectively cater for the people. We call on the government and all stakeholders to revisit the renovation of primary healthcare centers, especially in the rural areas where we have women who cannot afford primary healthcare services. If you have a story on corruption in your community and you would like us to talk about it, please share your comment by sending us a text or a WhatsApp message to 070-317-56537. Unmasking the Truth on the Effect of Corruption on Women from the Gender Lens is an initiative of St. Ives Communications in partnership with Voice of Women and supported by the Macarthur Foundation. Thank you to the producer Taiwo Adeleye and executive producer Tom Okewale Shonaya. I am Esther Alarib.
Ụmụ nwaanyị bụ ọkara ndị obodo Nigeria, mana ha na-agabiga ihe dị iche iche, ngụpụ na mkpuchi. 2021 Revised National Gender Policy arapụrụ onye ọbụla. Ọ na-asị mba, ekpuchi na onye ọbụla, akụpụla onye ọbụla. Anyị niile nwere ọlụ dịịrị anyị n'efu na onwere onye agụpụla agụpụ. Gaa www.rappernigeria.org ma chọọ nkọwa gbasara odumaga. Ozi a bụ Women Rights Advancement and Protection Alternative Rapper na the Federal Ministry of Women Affairs na nkwado Macarthur Foundation wetara ya.
WFM 91.7